I will be walking you through the Catch My Breath Youth Vaping Prevention presentation. This presentation was designed to be given to parents, teachers, and other community members and will describe the youth vaping epidemic and what can be done to address it. The following objectives will be covered during the course of the presentation today. What are e-cigarettes? How did we get here? The effects of vaping and what can be done. First, we are going to take a look at what an e-cigarette is. E-cigarettes are battery-powered devices that heats and disperses a liquid so that it can be inhaled into the lungs. All e-cigarettes contain a battery, a microprocessor, an atomizer, and a cartridge or a tank. There are many variations on the mechanism, but the basic process is the same. The microprocessor senses a change in pressure when the user inhales on the end of the e-cigarette. The microprocessor then instructs the atomizer to activate the heater and vaporize the liquid, which the user then inhales through the mouthpiece. The vapor is then drawn into the body in the same way as regular cigarettes. Vapor is defined as a substance diffused or suspended in the air, especially one normally liquid or solid. Think of the steam that comes from boiled water inside of a tea kettle. That's what a lot of people believe comes out of an e-cigarette. In reality, it's an aerosolized vapor. Aerosol is defined as a substance enclosed under pressure and able to be released as a fine spray, typically by the means of a propellant gas. Think of things like hairspray or room spray like Febreze. Although vaping is a slang term for using e-cigarettes, it's a term that's meant to make e-cigarette use sound less harmful than it really is. E-cigarettes come in several different forms: disposable, rechargeable, tanks, and refillable. This chart shows the evolution of e-cigarettes. First generation e-cigarettes were disposable and designed to look like traditional cigarettes and are intended to be used until the liquid runs out, at which point they are thrown away. Second generation vape pens are pen-shaped devices and can have a small refillable tank and a battery that can be recharged. Third generation tanks are large e-cigarettes with a rechargeable battery and a large refillable cartridge. These are also called mods because you can break them open and modify some of the parts. Fourth generation e-cigarettes have a sleek, high-tech design and easily rechargeable batteries. The most popular in this generation was the Juul. Juul uses small disposable pods that contain the e-liquid and is then inserted into the larger Juul device. A Juul device could be easily confused for a USB drive, and they can even be charged in laptops or computers. Other copycat products include the Soren Drop, My Blue, and Smoke Nord Kit, and these follow Juul's high-tech design and a high nicotine delivery through nicotine salt e-liquid variations. Fifth generation e-cigarettes have come about since the limited flavor ban, which we will discuss more later. These devices are designed to be similar to the fourth generation pod-based devices, but are disposable e-cigarettes. These are on the rise in popularity because they come in many flavors and often have a high nicotine concentration. This type of e-cigarette is currently not part of the flavor ban, and there are a variety of flavors available. Regardless of the generation or the brand, a vape, Juul, pen, mod, disposable, etc., are all variations of e-cigarettes and come with similar health and social consequences. There are more than 8,000 different flavors of e-liquid. The use of flavors to mask the harshness of tobacco is a seductive and deceptive marketing tactic that has been used by the tobacco industry for decades, including products like menthol cigarettes and fruit-flavored cigars. E-cigarette aerosol lacks the harsh burn of traditional cigarettes or cigars, making the first puff much friendlier on the palate and thus easier for kids to take up the habit. The FDA has taken some steps to mitigate the appeal to youth by prohibiting packaging that intentionally mimics food products. Pictured here is the popular kids' juice box, Treetop Apple Juice, next to the e-liquid called Juice Box. The Very Berry Slushie is another example of e-liquid packaging that has been banned. Although the FDA has implemented some restrictions on labeling requirements, they are still limited and not required on packaging, making it difficult for consumers to know what's contained in the e-liquid. In fact, some e-cigarettes marketed as containing 0% nicotine have been found to contain nicotine. Nicotine is a toxic, colorless, or yellowish, oily liquid that is the chief active component of tobacco. It acts as a stimulant in small doses, but in larger amounts, it blocks the action of nerve and muscle cells. Nicotine is also used in insecticides. An important note about nicotine is that it can be absorbed through the skin, so you should always take caution when handling vaping devices. Beyond nicotine, any substance that can be transformed into a liquid can be used in an e-cigarette. To make vaping devices more fashionable, many companies have created cases for phones and trendy hand-knitted vape sweaters. Perhaps the most shocking is the emergence of clothing specifically designed to conceal vaping devices. The clothing contains stealth pockets, providing a discrete location for the vaping device and to deliver the aerosol discreetly through hosing woven through the fabric. The clothing can be used for vaping without raising attention of parents, teachers, and other adults. The chart on the screen comes from the National Youth Tobacco Survey, which is administered by the CDC every year. About 20,000 students grades 6 through 12 are surveyed each year about their relationship with tobacco. From 2017 to 2019, there was a steady increase in current use. Current use is defined as use in the past 30 days. During that 3-year span, we saw a 135% increase among high school students and a 218% increase among middle school students. The story shifted slightly in 2020, with only 19.6% of high school students, which is about 1 in 5, and 4.7% of middle school students, which is about 1 in 20, reporting current e-cigarette use. Among current e-cigarette users in 2020, 38.9% of high school students and 20% of middle school students reported using e-cigarettes on 20 or more of the past 30 days. Even more shocking is the 22.5% of high school users and 9.4% of middle school users reporting daily use. In 2022, the National Youth Tobacco Survey format changed so that it could be completed online in schools or at home. Because of this change, the data from 2022 and beyond can't be directly compared to the previous years, but we can begin comparing the 2022 data to the newly released 2023 data. In 2022, there were more than 2.5 million high school and middle school students that were currently using e-cigarettes. Of those current users, 1 in 4 were using the e-cigarettes daily. Disposable devices were the most common type used, and about 85% were using flavored e-cigarettes. In 2023, the total number of middle and high school students currently using e-cigarettes decreased to 2.1 million. There were still 1 in 4 current users that were using e-cigarettes daily. Disposable e-cigarettes like Elf Bar and Esco Bar were the most popular brands used, followed by some pod-based devices. There was a slight increase in the percentage of users that were using flavored e-cigarettes, increasing from 85% to almost 90%. We have seen the high rates at which young people vape, but why did they start? The National Institute on Drug Abuse conducts a survey each year called Monitoring the Future. The survey is distributed to roughly 12,000 students across the country every year and asks them about various risk behaviors, tobacco and e-cigarette use being one of those. The 2019 Monitoring the Future survey results found the top 3 reasons why teens vape. The number 1 reason was to experiment to see what it's like. The number 2 reason was because it tastes good. And 2 responses tied for the number 3 reason: to have a good time with my friends and to relax or relieve tension. It's important to note that the teens who reported to relax or relieve tension increased by more than 1/3 compared to 2018. So why has there been this rapid and dramatic increase in youth use? This figure from the National Institutes of Health shows the knowledge gap that students have about e-liquid ingredients. What we see is not just that 13.7% of teens don't know what's in their e-cigarette, 66% believe it is just flavoring. As we learned earlier, there are many different chemicals in e-cigarette aerosol, and more often than not, there is nicotine. According to a study done by the CDC, 99% of e-cigarettes sold in 2015 contained nicotine. This lack of knowledge about e-cigarettes makes youth more susceptible to the misinformation they may encounter online or hear from their peers. Another major contributor to the increase in youth use is pervasive marketing and advertising. According to the 2019 National Youth Tobacco Survey, 7 in 10 kids are regularly exposed to e-cigarette advertisements. The chart on the screen shows a breakdown of where students are being exposed to these ads. It is no surprise that 58.4% of youth reported seeing e-cigarette advertisements in retail stores. For years, the tobacco industry has marketed their products in retail stores like gas stations, and the e-cigarette industry has been using the same marketing tactics as the tobacco industry once did. The next highest rate of exposure was via the internet at 44.6%, followed by TV, streaming services, or movies at 26.2%, and 34.8% were exposed via newspapers or magazines. It's important to teach kids to recognize e-cigarette ads, which can be stealthy and subtle in social media, so they can understand when they are being sold something. Think about your own social media use. You can control who you follow and who follows you, but you can't control the advertising that pops up. We also need to think about the influencers and celebrities that might use these products and post about them. Researchers found that in their early marketing campaigns, Juul clearly targeted young audiences. They crafted their brand and advertising around strategies that were appealing to teenagers. One major difference that set Juul apart from other companies was their strong social media presence, utilizing hashtags and peer-to-peer promotion through activities like Juul Challenges. These were stunts or activities devised by social media influencers that encourage people to take and post pictures or videos of themselves doing various things with their Juul devices. These kinds of social media tactics create the illusion of a grassroots campaign full of genuine enthusiasm and activity, but they are actually meticulously coordinated and strategic marketing campaigns. Other brands market their products on social media channels as well. Some companies even create a spot the vape technique to show users how easy the device is to conceal, like the vape sitting next to the makeup on the screen. Let's start by addressing a short-term effect that can have long-term consequences: addiction. We are all born with a potential for addiction, and it can manifest in different ways, such as alcohol use, nicotine, social media, exercise, caffeine, etc. So what's unhealthy about e-cigarettes? Using nicotine in adolescence can harm the parts of the brain that control attention, learning, mood, and impulse control. Since the human brain continues to develop until about the age 25, we need to prevent youth now from experimenting with vaping and other nicotine products, as we are much less likely to become addicted if we do pick up the habit after age 25. To understand how this works, we need to go over a little biology. Each time a new memory is created or a new skill is learned, stronger connections, or synapses, are built between brain cells. Young people's brains build synapses faster than adult brains. Nicotine changes the way that these synapses are formed, interfering with the brain's sensitive pleasure and rewards feedback loop. Because of this, nicotine in adolescence may also increase future risk of addiction to other drugs. It is important to note that until recently, Juul was the leader in the vaping market with incredibly high nicotine concentration at 5% in one pod. So what does this mean? The amount of nicotine in a single Juul pod and some disposables is equal to the amount of nicotine found in an entire pack of cigarettes and includes about the same number of puffs at 200. Some kids are developing nicotine habits equivalent to 2-pack-a-day smokers. Now, other e-cigarette brands are following suit, including many disposable e-cigarettes that often come in many flavors and are not a part of the limited flavor ban. The aerosol produced and inhaled when using an e-cigarette is not harmless and often contains many harmful ingredients. While e-cigarette aerosol generally contains fewer harmful chemicals than smoke from burned tobacco, it is important to keep in mind the difference between less harm and harmless. Jumping out of a third-story window will cause less harm than jumping out of a 10th-story window, but neither is harmless. The e-liquid that is heated to become the inhaled aerosol is typically the same whether it is a pod-based device, a refillable device, or a disposable device. The e-liquid may contain cancer-causing chemicals, heavy metals such as nickel, tin, and lead, and almost always contains nicotine. Research has found that the nicotine content and concentration in different vaping devices may vary. Some of the ingredients in e-cigarette aerosol could be physically harmful to the lungs in the long term. For example, some e-cigarette flavorings have been deemed safe to eat but not to inhale. It is difficult for consumers to know what e-cigarette products contain because, as we discussed earlier, labeling requirements are limited. Before the COVID-19 pandemic, there was a great alarm and concern over e-cigarette and vaping associated lung illness, also called EVALI. In early April 2019, the FDA issued an announcement regarding e-cigarettes, seizures, and lung disease. A quote from the FDA reads, "We have reports indicating that some people who use e-cigarettes, especially youth and young adults, are experiencing seizures following their use." Since then, the CDC issued the following statement. While it appears that vitamin E acetate is associated with lung injury associated with the use of e-cigarettes, vaping, or other products, there are many different substances and product sources that are being investigated, and there may be more than one cause. Between April 2019 and February 2020, there are almost 3,000 cases reported in all 50 states, Puerto Rico, and the Virgin Islands of EVALI, and there were 68 deaths related to e-cigarette and vaping use. Despite the lack of new cases being reported since February 2020, most likely due to the outbreak of COVID-19, CDC still advises the following. E-cigarette or vaping products should never be used by youth, young adults, or women who are pregnant. Adults who do not currently use tobacco products should not start using e-cigarettes or vaping products. There is no safe tobacco products. All tobacco products, including e-cigarettes, carry a risk. There are many different symptoms that an adolescent may experience after they begin vaping. A lot of the symptoms are also similar to illnesses like COVID-19, the flu, and pneumonia. These symptoms may appear quickly after use has begun, or they might take time to develop. Chest symptoms that may appear include cough, chest, and shortness of breath. Abdominal symptoms that may appear include nausea, vomiting, and diarrhea, and other symptoms include increased heart rate, fever, chills, and fatigue. Additionally, an August 2020 study from Stanford University found that those who vape are 5 times as likely to contract COVID-19 as those who do not vape. To compound this, if you vape and smoke, you are 7 times as likely to contract COVID-19. We have learned if someone uses a nicotine product, the chemical is absorbed into their system and their mood and pleasure centers are aroused. The tolerance and physical dependence for the substance increases as use continues. Going without nicotine can produce withdrawal symptoms as well as a craving for more nicotine. As we continue to learn about vaping and nicotine addiction, there are signs to look for to identify if a child is vaping. If a child is normally calm and very easygoing, but now they seem very anxious and irritable with not a lot of patience, is it just the teenage years, or could the child be vaping? Often someone who is dependent on nicotine has a difficulty concentrating. If a child is vaping and they are having a nicotine withdrawal in class, they may not be paying attention to the teacher, but rather thinking of when they can get their next nicotine fix or their vaping device. Other symptoms include change in eating patterns, which can result in weight gain or loss, mouth sores or irritation around the mouth from being exposed to the chemicals in the aerosol, and an increase in thirst because some of the chemicals found in e-liquid can cause dry mouth. If a child at home has a sudden interest in burning candles or incense, it could be because they are trying to hide the scent from their e-cigarette. The same goes for a sudden interest in using perfume or cologne. It can be used to hide the smell of the flavored aerosol. I want to reinforce that none of these signs are a surefire signal that a child is vaping, rather they are a path to start a conversation. To help facilitate a conversation with a child about vaping, the Surgeon General published a guide titled Talk with Your Teen About E-Cigarettes, a tip sheet for parents. The following is a summary of that tip sheet. Before you start the conversation, know the facts. When you start the conversation, do not start with, "We need to talk." No one likes to hear that, and usually our immediate thought is, "Oh no, what did I do wrong?" Instead, bring up a recent event or news story about vaping. It is a safe way to start the conversation without accusing your child of vaping. Ask for support from your healthcare provider and other trusted adults. Answer their questions, and if there is something you don't know, let them know that it is a good question and you will find out the answer. This is not a one and done conversation. Keep the conversation going, as this is an ongoing emerging health crisis among our young population. Remind and repeat. Know what cessation resources are available for young people to quit vaping. Evidence has found that children who needed to check in with their parents about their free time were half as likely to try tobacco products. These simple questions, where, who, when, can have a big effect on their decisions, including whether or not to try e-cigarettes. A few rules about their free time can prevent opportunities for risky behavior. Know where they are going, with who and when they will be back. Keep them busy by enrolling them in after-school activities they enjoy. Know their teachers and coaches and be sure to attend the events they participate in. Make connections with their friends' parents and set rules regarding adult supervision and curfews. Checking in with your child decreases opportunities to make risky choices about tobacco products and alerts you to possible outcomes. It is also helpful to know what you're up against. If you are going to have a conversation with your child about not vaping, it is important to remember these 4 key points. Establish what you expect, why it's important, how to respond, and consequences if they do it. In January of 2020, the limited flavor ban went into effect, which banned all flavored, pre-filled pods except menthol and tobacco flavors. The FDA also finalized an enforcement policy to punish any retailers caught selling unauthorized flavors of cartridge-based e-cigarettes. While this is a significant step forward, it's important to note that the new ban only includes closed, pre-filled pods like Juul cartridges and does not cover disposable e-cigarettes like Puff Bar. The ban also exempts refillable pod systems, including products like the Soar and Drop and the Smoke Nord kit. Although there has been recent action by the FDA to remove disposable e-cigarettes and youth-appealing e-liquids from the market for not having required authorization, flavors are still allowed and widely available on the market. We are already seeing that kids are shifting from brands like Juul to these inexpensive, disposable flavored products. In December of 2019, a law was passed to raise the minimum age of sale of tobacco products from 18 to 21 years old nationwide. This will play an important role in cutting off youth access to tobacco products through older friends, as the age gap now extends well beyond high school age. Next, we will discuss the Catch My Breath vaping prevention program that can be taught in our Defiance County schools. Catch My Breath is a nicotine vaping prevention program that has been proven effective at reducing the likelihood that students will experiment with vaping. The program explains health behaviors are products of personal, social, and environmental factors. In addition to building knowledge, Catch My Breath disrupts normative beliefs such as the notion that everyone is doing it. Students develop skills to help them resist peer pressure and see through advertising and misinformation that perpetuates online and from their peers. As a whole, the program creates favorable attitudes and beliefs about not using e-cigarettes. In January of 2020, Catch My Breath demonstrated effectiveness in a peer-reviewed study, making it the first evidence-based youth prevention program. The study was published in Public Health Reports, the official journal of the U.S. Surgeon General. This slide includes feedback from real students who have completed the Catch My Breath program. One student said, "I didn't know that vaping was so bad. A lot of people do it because other people do it. I would tell them to stop now that I know how bad it is." Please let me know if any of you have any questions. I would be more than happy to answer them. My email is on the screen as well as my phone number with my extension. Thank you.